28.8 million Americans will have an eating disorder in their lifetime, and every 52 minutes, one person dies as a direct consequence of an eating disorder, according to the National Eating Disorder Association. This makes eating disorders the second highest mortality rate of any psychiatric illness behind opioid addictions. Nurse practitioner Elle Weese, who focuses on helping people with eating disorders or other ongoing health problems, located at our newest Neurocare Center in Layton, Utah, breaks down what you should know about eating disorders, the common types, steps in treatment, and how you can support a loved one with an eating disorder.
An eating disorder is defined by the American Psychiatric Association as a severe persistent eating behavior that is also associated with emotions that are problematic for the patient. So both of the two things have to be together usually. And the different types of eating disorders, the ones that I see most commonly in my practice and the ones that are most familiar with those around are anorexia nervosa, which is characterized by self-starvation. We have bulimia, which is an alternating with dieting, but there also can be other behaviors like purging, which is vomiting the food, or there's other compensatory behaviors that also are associated with it. We have binge eating disorder, which is where the patient will eat a large volume of food in a short amount of time, but they don't have any other compensatory behaviors that are paired with it. The other eating disorders that I see, but not as frequently, is called RFID. It's avoidant restrictive food disorder, which is where the patient consistently cannot meet their nutritional needs. And then even less, as far as what I see pica, and that's where the patient will consume foods with no nutritional value, non-foods with no nutritional value. And then the other one that we've seen is rumination, which is where the patient will regurgitate the food that they've just eaten, re-chew it, re-swallow it, and they may do this multiple times and then spit the food out or swallow it. So, but those are the main ones that we see, but there are many others and subtypes of eating disorders. The patient demographics I typically see are female, ages 16 to 34. I have medically evaluated patients who are male. I have some patients that are in their 70s and even 80s. It can affect anybody, honestly. There are many different ways to treat a patient with an eating disorder. A lot of it depends on what type of eating disorder they have. Evidence shows that a patient will have a better outcome or more positive outcomes if they are treated by a multidisciplinary team. This team should consist of a medical provider. It should also consist of a psychiatrist, a registered dietitian, and a mental health therapist, and preferably with everyone having some kind of background working with patients with eating disorders. My role is to medically evaluate the patient, make sure that they are first, that they're safe and able to stay working in the outpatient clinic and continue working with their eating disorder team. I will typically do quite a few labs to make sure that they're not having any abnormalities in their levels that might progress into something worse. I will also do imaging. A lot of that also depends on the type of eating disorder, and it will depend on how long they've had their eating disorder. So it is individualized as far as what I do, but the ultimate goal is always to make sure the patient is safe and that they can continue working in the outpatient setting. The main thing that I wish most people knew about eating disorders is it's not a choice. There's typically something that has precipitated that particular adoption of an eating disorder. And it can be many different things, but it is never a choice. And that's one thing I would really like everyone to know. So how can you support a loved one or a friend or a family member with an eating disorder? I highly recommend going to the National Eating Disorders Association.org website. And on that website, they have tons of resources on there on how to approach your loved one, what ways you can best support them, maybe what things you can do to help support them during this hard time for them. On this website, There's also resources on there for if you're a teacher and you have a student that you suspect having an eating disorder, or if you have a patient that you suspect that has an eating disorder. There's over 150 different behaviors associated with eating disorders, and there's these different combination of permutations of the behaviors, and it depends on the time of day or what environment they're in or what people are around them. And so there's a lot of nuances to it. And it's kind of, as a loved one, you feel like you're walking through a minefield because you don't know what to say, you don't know what to do. And so just being with them to their appointment, if you feel like that would be helpful, if the patient wants you to be there, then accompany them, please.